A number of countries have imposed entry restrictions on travelers from China following a surge in coronavirus cases. For Uganda, the Health Ministry's Incident Commander, Dr. Henry Kyobe, says there is no need to worry about these developments. However, he admits that they are concerned and taking all precautions to avoid a resurgence.
To make early detection, should the new variants come through. When it comes to the testing, the laboratory network is much more extensive now, so we can quickly and easily test.
Uganda has not registered a surge in COVID cases. Weekly, about 80 to 100 cases are registered, which translates to a positivity rate of about 1%. For at least 6 weeks, there is no patient on admission and no COVID death has been registered.
No, they are mainly from the community. Remember, we are no longer testing travelers. Then the other thing is that maybe they are slightly more because the RDTs, which we don't capture the national grid as we do for the PCR. But still, there are very few confirmed cases.
The new variants have increased transmissibility of COVID, although it is less fatal.
Because these variants will get here, there's no doubt about that. And again, we are not about to think about closing the borders or stopping anyone from coming. These variants will come through. And when they come through, then we'll start having extensive transmission that we see in other countries that we spoke about at the beginning.
The Ministry of Health has urged the public to embrace vaccination as one of the ways to guard against the resurgence of cases. Government says the country is better prepared compared to the previous waves in terms of bed capacity, early detection, among others.
Oxygen, the mainstay treatment, we are in much better capacity, that we have oxygen plants installed in all regional referral hospitals, which capacity we didn't have before.
Lieutenant Colonel Dr. Henry Kyobe is one of the people who has been at the heart of fighting COVID-19 pandemic and Ebola outbreak at the Ministry of Health. Given his career in the military, some ask, who is Dr. Kyobe?
Yeah, I'm a cadet trained military officer. I'm also a doctor.
Dr. Kyobe is the incident commander at the Ministry of Health, tasked to oversight operations such as case management, laboratory services, among others.
Talk about patient care, talk about what you call case management, talk about laboratory in case of diagnosis, talk about disease finding, the surveillance, talk about risk communication.
Dr. Kyobe holds a bachelor's degree in medicine and surgery from Makerere University and a master's of science from the Institute of Tropical Medicine in Antwerp, Belgium. He has been part of the Ebola teams both in Uganda and across the continent.
On request of WHO to UPDF, I was deployed to West Africa, Sierra Leone. But again, I worked on an outbreak of dengue. Have you ever heard about dengue? Maybe not. Dengue, hemorrhagic fever amongst our troops in Somalia.
Norbert Atkunda, NTV News.